I'm Nicole Stallings, HAP President and CEO. For 45 years, HAP's Achievement Awards have showcased the very best in healthcare across the Commonwealth. A lot has changed since this program began, but our world-class hospitals remain focused on providing safe, compassionate, equitable, and high-quality care. Their ceaseless drive towards innovation is made possible by professionals and leaders who understand that the complex and changing world of healthcare demands continuous improvement and problem solving. Whether they're improving maternal health outcomes, addressing food insecurity, ensuring access to care in rural communities, or expanding the healthcare workforce, our award recipients are enhancing the lives of all Pennsylvanians. We are excited to share more about their accomplishments.
HAP is honored to celebrate the 45th class of HAP Achievement Award winners. Let's celebrate the 2024 honorees. The Community Champions Award celebrates organizations for advancing the health and well-being of their communities. Independence Health Clarion Hospital is meeting the needs of rural communities by shifting focus from illness care to wellness care. Patients with COPD or pneumonia are paired with a care transition navigator who ensures they have access to preventive care and community resources after discharge. St. Luke's University Health Network is improving sustainable food access for underserved populations. The hospital network partners with local food banks, prepares emergency meals, and fosters relationships with local school districts to host food distribution events tailored to each community's unique needs. The Optimal Operations Award recognizes hospitals that drive strong organization performance. Guthrie Robert Packer Hospital decreased the rate of patients leaving the emergency departments without being seen by half and has maintained the new standard, even when patient volumes are high. The hospital implemented a rapid assessment area and a new patient flow model with a multidisciplinary team approach. Bryn Mawr Rehabilitation Hospital is taking a systematic approach to standardize CMS quality indicator scoring for acute inpatient rehabilitation patients at discharge. The hospital developed educational modules and opened effective communication channels to yield improvements. Mainline Health drastically improved emergency department throughput across all 4 campuses. The team deployed a rapid improvement strategy that decreased wait times and reduced left without being seen rates by 46% through a new process improvement tool used throughout its emergency departments. The In Safe Hands Award honors Pennsylvania providers for their constant quest to improve patient safety. Nazareth Hospital is implementing new procedures to eliminate central line-associated bloodstream infections. The hospital created a vascular access team to ensure prevention strategies are in place, leading to a significant reduction in infections. Penn State Health Milton S. Hershey Medical Center is decreasing central line bloodstream infections in pediatric oncology patients through robust environmental controls and a dedicated work surface for aseptic supplies. After implementation, the unit had 0 infection events during 2023. The Excellence in Care Award commends patient-centric initiatives that strengthen care quality. Penn Medicine Chester County Hospital is decreasing healthcare disparities and improving maternal care for new moms in the Hispanic community. In partnership with the hospital's Patient Family and Advisory Council, the hospital builds trusted relationships with Spanish-speaking patients and ensures interpreters are included at every step along the care journey. Temple Health is putting patients first and removing barriers to preventive colorectal cancer screenings. Its program integrates cancer prevention education and testing at the hospital and community level, improving patient satisfaction and population health outcomes. The Workforce Innovators Award recognizes hospitals that are engaging the healthcare workforce through projects to attract, develop, and retain health professionals. West Virginia University Medicine Uniontown Hospital is taking an all-hands-on approach to transform culture, governance, and leadership to improve patient safety. The hospital is reshaping employee engagement, quality, patient experience, and financial sustainability through this cultural transformation. Pennsylvania Hospital is pioneering real-time clinical support, professional development, and well-being for new-to-practice night shift nurses through a Clinical Nurse Ambassador program. Ambassadors respond to clinical emergencies, facilitate skill education, validate competencies, and during the first year of the program, engaged in more than 1,000 interactions with new staff. Reading Hospital is giving high school students healthcare career exploration opportunities through hands-on experiences. The internship program fosters partnerships with local school districts to bring together students with diverse backgrounds while working to close gaps in hospital staffing. The Living the Vision Award is presented each year to an outstanding project with significant accomplishments toward better health, better care, and lower costs. The 2024 Living the Vision Award winner is Penn Medicine Lancaster General Hospital for their food pharmacy program. The program was created to address health disparities among people who are food insecure by pairing nutrition counseling with access to healthy foods. A healthy diet and lifestyle changes can significantly impact overall health. Lancaster General's food pharmacy program provides patients with one-on-one nutrition counseling sessions with a registered dietitian and access to healthy food options at the nearest food pantry.
The food pharmacy represents an important part of us fulfilling our mission. In our county, over 40,000 people experience some form of food insecurity.
When you look at poverty and you look at issues that surround poverty and how to tackle it, we have a firm conviction that to find solutions, it has to be collaborative. Not one of us is going to sit at the table by ourselves and solve it. It takes all of us.
We know that there are a series of health conditions and diseases that are a result of obesity and food insecurity. Such things as diabetes, hypertension, heart disease, and the board felt that those were important issues to tackle.
Lancaster General Hospital's food pharmacy program provides nutrition-related knowledge, skills, and dietary habits among patients who are experiencing food insecurity, improves health outcomes and prevents chronic diseases such as heart disease, diabetes, and cancer, works with community food pantries to offer healthier choices for all clients.
When patients present to one of our practices, if they are experiencing food insecurity and have a chronic disease, they are referred to our program. Once enrolled in the program, they will meet one-on-one with a dietitian, and throughout the year of the program, they will receive one-on-one nutrition counseling, education, and get to grocery shop with the dietitian in the food pantry locations.
I think the biggest thing was the fact that when I go to the grocery store now, I read the label on everything. I take my time. It's going to take me time to read them, but I read the label on everything. And if I'm in an area where there are not a lot of healthy choices, I can look now and tell what is the best choice out of the not so good choices. So she taught me how to do that.
It's fun to me to hear stories, learning how to read labels, learning how to make decisions when you're on a fixed income or no income at times, how to engage in a pantry like we have.
For me personally, I found when I talk to my patients at the end of the program, I kind of ask what they got out of it. A lot of it comes down to that support. When people come in, they generally have some type of base knowledge. It's more about how do they apply that knowledge and how do they make it work within their lives.
The results have been outstanding. Close to 50% of participants reported decreased food insecurity. And since its inception in 2019, the program has grown from 1 dietitian to 3, and expanded from 3 locations to 6. Served over 400 patients and more than 800 family members. And achieved positive clinical outcomes with 73% of participants reporting improved healthy eating habits, 66% of program graduates have improved blood pressure, and 60% reporting increased confidence in their nutrition skills.
My A1C, before I started that program, was up around 11.8, and my readings are around 135, 136 consistent now, so I know she's going to be really pleased when I go.
The board's investment in the food pharmacy, which began in 2019, resulted in the board committing $2.9 million over a 5-year period. We think that that's important, that the community knows that the board has made that commitment from its finances. We've now set up food pharmacies at 6 different locations, and to date, 800 individuals have been impacted.
And to be on the receiving end, it's very humbling. But I didn't feel bad because they gave me respect and they appreciated the fact that they knew I was trying. And I'm still trying. I'm still working on it. So.
Congratulations to the 2024 Achievement Award winners. We're thankful for all you do to create a healthy Pennsylvania.